Hello, good evening. It's as serious as it gets. Doctors in some parts of the country are urging people not to attend A&E unless their condition is urgent or life-threatening. ICU admissions and deaths from COVID have dropped and vaccines have protected the majority from serious illness. But case numbers are at their highest rate, with 1 in 11 people in Scotland estimated to have the virus. Brandon Cook has been to a community hospital in Aberdeenshire to find out how they're coping there.
Inside this small building are people facing big challenges.
We've got 4-bedded rooms, we have single rooms as well.
Staff at Inverurie Hospital are busy, focused on rehabilitation and getting people, usually elderly, back on their feet. There's 9 community hospitals like this across Aberdeenshire. All are feeling the strain of high COVID case numbers, especially in the area's larger hospitals. When beds are full there, people come here.
We have patients on the list at ERI, Aberdeen Infirmary, ready to come into us.
It's now at the stage where patients are being warned they may not have all their health requirements met, as staff weather what some have called a perfect storm.
It's been really busy. The pressures for beds has been quite horrendous. Obviously staffing at the minute is okay, but we have had staff off sick as well. But we've had constant pressure to take patients in from ARI and the community, and it's just trying to move patients back home, get them into the community again. But unfortunately, there's a knock-on effect in the community because the carers, they have a lack of carers in the community also.
Although this hospital doesn't take in as many COVID patients, it still really does feel the effect from the disease, doesn't it?
It does, yeah. We do have COVID patients. We have had outbreaks as well over the last couple of years. Obviously, it has a knock-on effect with the patients and the staffing as well. And it's quite a stressful time and an unsettling time for us all.
Across Scotland, health boards say they're facing acute challenges in clinical care. Some non-emergency services have been reduced, affecting waiting times for elective treatments. In Grampian alone, there's around 162 people in hospital right now with COVID, 1 in ICU. And if there's a significant outbreak in smaller facilities, like this one, then the transferring of patients needs to stop, causing a backlog in resources.
I think this last week has been one of the worst weeks that we've had within the Aberdeenshire Health and Social Care Partnership within our community hospitals. We've seen an increased number of cases throughout the Shire, and it has been tough for everybody. All the nurses and AHPs, domestic staff have worked really hard.
Everyone working here will carry on just like they have for 2 years. But while restrictions on daily life may have eased, the impact of COVID on the health service continues to be challenging. Brandon Cook, STV News.
Well, we're joined now by Health Secretary Humza Yousaf.